I'll be presenting today's Radiopedia.org case in Radiology, Polymorphous low-grade neuroepithelial tumor of the young. Case courtesy is demonstrated here. Case link is in the description below. Presentation: we have a 20-year-old male presenting with a single episode of generalized tonic-clonic seizure. Taking a look at the MRI brain here in the sagittal view, T1 weighted without contrast. There's a solitary intraaxial cortical-based lesion within the right temporal lobe. The lesion exhibits internal T1 hyperintense components and a markedly hypointense component. Here, the T1 weighted image with contrast. There's no contrast enhancement. The MRI Brain Axial View SWI, we do have a susceptibility artifact in keeping with calcium. Susceptibility weighted imaging is an MRI sequence that's particularly sensitive to compounds which distort the local magnetic field and as such make it useful in detecting things such as blood products and calcium. Here are the MRI of the brain images, T2 weighted. Here in the axial plane, there are peripheral T2 hyperintense subcentimeter cysts of varying sizes. The coronal views, we can see these cysts here and here. This patient underwent resection of the temporal lesion. Pathology revealed polymorphous low-grade neuroepithelial tumor of the young, which is CD34 positive and exhibits BRAF mutations. The differential diagnosis on imaging includes oligodendroglioma, which has calcifications. However, they have a more ribbon-like appearance. Cystic changes, it's well circumscribed, and contrary to the polymorphous neuroepithelial tumor of the young, oligodendroglioma is most common in the frontal lobe. We also have pleomorphic xanthoastrocytoma, which can demonstrate a dural tail sign and significant contrast enhancement, ganglioglioma, which will show a cystic mass with intense enhancing mural nodule within, and no calcifications. Two other differentials include dysembryoplastic neuroepithelial tumors, which have a soap bubble appearance, and focal cortical dysplasia, which has thickening of the cortex, blurring of the white matter-gray matter junction, and the transmantle sign, which is demonstrated here, which is a high flare signal or T2 signal extending from the ventricle to the cortex.